name. I'm Amber Lovatos. And I'm super excited to make it to the second round. I'm going to talk to you about how I turned my pain into my passion. We're going to take you back to when Amber was a little girl. My parents are immigrants from Mexico. I'm first generation Mexican-American, where we were low income. My parents went to 6th grade education in Mexico, so they didn't know anything about oral health, which meant that they didn't teach me anything about oral health. They didn't tell me to brush my teeth. I don't know that I even really had a toothbrush. They didn't tell me to floss because they didn't know that flossing was a thing. So I obviously had a lot of dental problems. The first time I went to a dentist, I was a tween. I went to a dentist because I was in pain. I'm sure the dentist told my parents that I needed a root canal, which they couldn't afford. So instead, my mom took me home and we ground up cloves and then we put water on it and put that in my tooth. And then I slept away the pain. The next time I went to a dentist, I was 15. My cousin had given my mom unsolicited advice and told her that, if you just take out a few of Amber's teeth, her teeth will be straight. And we know that that's not true, right? But my mom didn't know that's not true. So my mom, wanting the best for me, took me to Mexico, and for 200 pesos, which is $20, they extracted my maxillary permanent canines. So I know now when you see me smile, you're going to think, dang, she's got some sharp premolars. After that, the next time I went to a dentist, I was 18. That was the first time I received preventative or restorative dental care. At 17, I became a teen mom. Because I was low income, I qualified for Medicaid, which I don't think that, teen pregnancy should be the gateway to dental care. But for me, it was. They had to extract my mandibular first molars because the decay was so bad, which made occlusion identification on me in hygiene school really difficult because I didn't have molars or canines. They had to do crowns and root canals and fillings. I'm pretty sure they did perio treatment. And this is embarrassing, but as a teenager, I remember I would wake up in the morning, there'd be blood on my pillow, and there'd be dry blood in my commissures. My mouth would be thick. And I didn't know why this was. I thought this was normal. But I made a connection that after I got a cleaning, that stopped. We're going to fast forward 15 years. I've now been a hygienist 7 years, and I spent the majority of that volunteering. I organized over 40 community outreach events where we've done oral cancer screenings, fluoride applications, sealants days, hygiene care days. I volunteered for the Special Olympics, making sports guards for the athletes. I've volunteered for Texas Mission of Mercy, organizing the events, not just volunteering at the events. I am now the dental director at TOMAGWA HealthCare Ministries. We're a nonprofit community dental clinic. We provide affordable and comprehensive dental care to uninsured and low-income individuals, and we educate them. To give you an example, our extractions are $25, our fillings are $13, our crowns are $150. We go to Title I schools, do exams, fluoride applications, and those kids, when they come back to us and receive care. Last year, I did my first CE for a Cause, where I recruited big-time speakers like Katrina Sanders, Emily Bogie, Denise Mans, Catherine Gillum, who donated their times, and some of them, their honorarium. And the money that we raised went back to our clinic. And then we served more people. This year, I got the ADHA IOH grant for $10,000 so that I can go out to rural communities to provide care. And that's how I turned my pain into passion. Thank you.